Welcome to the presentation. And my name is Craig Wiener. And I've written 3 books on ADHD. And today I'd like to try to have all of you learn another way to understand ADHD and another way to treat ADHD. So the presentation will take about 45 minutes or so. We'll have time for questions and things like that. But my hope is that you just come to look at this problem in a new way. I know that our culture, we've come to see ADHD as a medical problem, and I'll show you what that's all about and another way to understand the diagnosis and what to do. So the presentation is going to be based on these 3 books. These first 2 books were academic books. The first book, A Return to Psychology, was to take each of the biological arguments and interpretations of the research and show how it could be understood in a different way. And the second book was a intervention for therapists to read. And then I was approached to write a parenting book to take my views and put it in a easier to read format, and that's the book that's being highlighted here. So what is ADHD in its current conceptualization? So it's thought to be a biogenetic problem where the child is hyperactive, impulsive, and distracted. And when I first started practicing is 2-3%, and then went 4%, 5%. It's up to like 9.5% and counting. And the issue is once we come to understand a behavior in a certain way, we start to see it. And the more we see it, the more we identify it and treat it. And you also need the diagnosis to get kids on ed plans and things like that. So there's a push in our social group just to have a diagnosis so you can get help. So it's thought in the biological view, it's thought that these kids have an inferior biological mechanism that prevents them from stopping themselves and being able to think about what they're going to do before they take action. So the view says that unless people can inhibit an initial reaction and then engage executive functioning and concentrate long enough to generate effective long-term responses, you're going to be enticed by immediate gratifications. All right? That's the view. It's called an inhibitory problem. It's based, now, in terms of biology, it's based on 3 what I call pillars. That's me in Italy. I couldn't wait to get to the 3 pillars to show that. So first of all, it runs in families, and people know this. And identical twins are almost always concordant, which means that if one identical twin is diagnosed, it's likely the other one will be diagnosed as well or qualify for diagnosis. Now, the other thing they found since they've been studying molecular biology is that people with ADHD seem to share a genetic biology, and it's said to increase the probability of diagnosis by 50%. Now, the other thing they do is, since they've learned about studying the brain with brain scans and certain tests that look at brain functioning, they found that the structure of ADHD kids is different, the responding patterns of the brain are different, and the brain chemistry is different. That's the second pillar. So the first pillar is genetics and the brain differences. And the third thing is, because medications seem to instantly take the behaviors away, it must be that they're correcting a medical problem or a biological deficit. So why would the medications work so beautifully if it wasn't a biological problem? But now let's look at these 3 pillars more closely. First, genetic research doesn't establish biological causality. There are many people diagnosed with ADHD without the genetic variations, and there are many people not diagnosed with ADHD with the genetic variations. So the genetics don't cause ADHD. Remember, compared to other medical problems, there's no biological marker that will tell you have ADHD. There's too many false positives and negatives. Now, you don't get that with diabetes or nearsightedness. Now, The other thing is when the base rate of a behavior is 9%, a 50% increase only means the behavior increases from 9% to 13.5% if you have the genetics. It's only a slight bump up. But didn't it sound like a lot when I first said it? But it's not. It's not a big deal. Now, I don't want to lead you to the impression that biology isn't important in psychology, right? In psychology, we often anticipate that biology will change the probability of what you learn. Now, there's probably a few things that the range of biologies that we all have, we all seem to do the same behavior, but most of the time, if you have a different biology, you learn differently. So related people have similar bodies and environments, so why would we would expect their learning patterns to be correlated? This becomes extreme with identical twins, where there's a heightened confounding of genetics and learning. So it doesn't matter if you're the birth parent or the adopted parent, biology changes the probability of what is learned. So if you're very, very tall, what's more likely to be learned? Basketball. If you're physically attractive, you're more likely to learn to be socially popular. If you're physically awkward, you're going to learn sports avoidance, low social status. There's going to be learning consequences for your biology. So we're not blaming parents when we talk about psychology. This says, oh my God, you're right. It all makes sense. I crossed the road because of my parents. So the view that I'm talking about is that kids with particular kinds of problems are more likely to develop ADHD behavior. Developmental delay, coordination disorder, specific speech and learning problems, health complications, short attention span with objects, high activity levels, negative infant temperament. That's all going to change the course of learning in your childhood. But while there are many people who do not have these early occurring problems that still end up with the diagnosis becomes more probable when you have that temporal origin. ADHD is more likely to develop under conditions of adversity because the kid if you have trouble making it in this world, you're more likely to learn these behaviors as a way to negotiate the world. And I'll get into that as we go. Now, in traditional view, you have functional delays, and ADHD is considered a functional delay, another kind of functional delay. In the view I'm talking about here, you have functional delays, and then of those people, some go on to do ADHD behaviors. Remember, you can influence heritability quotients by changing the course of development. Heredity doesn't mean destiny. Genetics isn't fate. It's a temporal origin, and many things can happen through development that change. You don't get that much predictability from the genetics because we're not like lizards. There's a lot of possibility of influencing people. Even if your kid starts off with a negative infant temperament or high activity levels or developmental problems, there are lots of things are possible. So yes, people with ADHD tend to have different brain biology. This is the second pillar. But the way you live and learn can also affect the biology of your brain. For example, dopamine levels change with positive experiences. And by the way, they just had some new research that came out that said the dopamine patterns aren't any different from ADHD to non-ADHD people. So the research isn't always the same, depending on the study. Differences in brain response may relate to learning. So they do a study that shows that the MRI differs, your brain flow will differ in relation to observing someone with the same or different political affiliation. So if you're a Democrat and you see someone else as a Democrat, you're going to have a different brain response. So why were we surprised that people differ in their brain responses depending on their learning history? Patterns of brain activation and arousal can be a function of what you're doing and what you've learned. Now, interestingly enough, with musicians, if you play a musical instrument, your planum temporale will become larger and more asymmetrical as a function of playing the musical instrument. Cab drivers in London develop their visual spatial cortex as a function of driving through the city streets all day. Differences in brain structure occur as a consequence of living in the world. Even your gray matter can change in relation to living in the world experiences. So in sum, for the first two pillars, relationships between patterns of living and biological developments show the consequence of the co-occurrence of biology and environment. They don't show biology, they show biology and environment. So it's not surprising that ADHD alters brain development and impairs skills and achievement. As the saying goes, if you don't use it, you lose it. So kids with ADHD's brains could be developing differently if we intervene differently. And that's my hope. I'll show you how to do this. So in review, biological causality is not established by the first two pillars. You have biology or impairment that comes before ADHD, but that doesn't demonstrate incipient ADHD. It only demonstrates an increased probability that ADHD behaviors will evolve. Many different outcomes can occur as development unfolds. 2, we may have biology or impairment that occurs with or after ADHD, but co-occurrence does not show causality. Biology and skill acquisition are influenced by the way a person lives in the world. Do you see how there's a different way to look at these two first pillars? Now the third pillar, yes, medicine reduces ADHD behavior, but that doesn't tell you the cause of ADHD behavior. Alcohol helps a person become more sociable, doesn't tell you why they weren't sociable. And by the way, research is clearly showing that we all respond to ADHD medicine the same way. That's why college kids are taking it with such high frequency rates. That's why it's a drug of abuse, because it increases your performance by 15%. ADHD medicines can be a potent and practical solution. It helps with urgency when urgency of a problem, or when the participant's resources are limited, and that's the only and most, you need a quick change. That'll do the trick, but it doesn't tell you the cause of ADHD. So there's your 3 pillars. Now let's talk. This whole medical view has a load of inconsistencies. Why would a biological disability respond so remarkably to bribery, personal interest, the source of the instruction, whether the child initiates the action to do the behavior or whether you instruct the action? Parents ask all the time, why can my child function so well when she's doing what she wants to do? If I'm nearsighted, I'm nearsighted whether I want to be or not. All right? Psychology must be involved if the problem relates to personal interest. History of conditioning can account for the frequency rates of ADHD behavior. If ADHD follows a situational patterning, and I'll show you the situations that increase the probability of ADHD diagnosis and the situations that decrease the probability of ADHD. This indicates that psychology is involved and the behaviors are consistent with a learning paradigm. Now let's look at some cartoons to show the situational patterns of ADHD behavior. These cartoons were done by Brian Nelson, who's the author of Laurel from the newspaper. Hyperactivity occurs when parents are on the phone, but not if bedtime's extended while the parent talks, and they don't make a peep. Distractibility prevails when writing a thank you note, but not when writing a Christmas list. Blurting occurs when vying for attention or provoking, but not when there could be incrimination. So try to get them to blurt out then. Did you do it? Unpleasant appointments are often missed, but it's first in line for scheduled trips to the movies. The daily planner is cast aside while plans on Facebook are being made. Personal belongings are scattered about while battle scenes are meticulously arranged. Now you say the kid's got organizational problems. Well, they organize this battle scene. Well, the other guys are here, and the snipers are over here, and the 3 guys are over there, and they're down here. That's all the skill you need to clean your room. Chores are left undone, but the house sparkles when buttering up the parent. Contemplation is evident when making a purchase, but not when shopping for a sibling. This reminds me of this famous cartoon, Watch What I Can Do, Make Pavlov Do. As soon as I drool, he'll smile and I'll write in his little book. So what increases ADHD behaviors? Avoidance. So you can avoid situations that have in your learning history are associated with negativity, adversity, failure, loss of loss of discretionary authority. Antagonism. We know that relationships can become contentious sometimes, and ADHD behaviors can make you mad. It's not just attention, it's actually making you mad. Now, one of the benefits of that is after the child evokes an angry reaction from you, then you feel badly as a parent. So the issue started out with the kid misbehaving, and it ends up with the parent doing what? Apologizing. Accommodation. Please turn it down. Daddy's trying to do your homework. Acquisition. So this is the whole thing about preventing denial. These behaviors can get the chocolate cake first, can get to the first in the line, can get you before you can stop. It prevents denial. So if the situation triggers anxiety about denial, you could get an ADHD response. And they say, we didn't think before he acted. No, he got what he wanted, didn't he? Attention, which is the classic one. Avoidance and attention are either primary. And accommodation now. Being loud has its advantages. Often the loudest in the room gets what? The most? Okay. So let's take some examples of what I call the 5 A's, these 5 reinforcements. Your child's dancing in front of a stranger in a waiting room while you're reading a magazine. You ask her to come to you and look at the pictures in the magazine that you're reading. What's the reinforcement? Attention. Your child sticks out his leg and trips his younger brother. You yell at him and send him to his room and go after him. Antagonism. Your child reaches quickly to get the food before others and knocks over his milk. You clean up the spill while your child continues to eat. Acquisition. You ask your daughter to help you put away the groceries, but she keeps watching the television without responding. You keep calling her and continue to put things away. Avoidance. See how they work? You get examples, and you learn. I hope parents learn what's reinforcing behavior for your particular situation. Your child's groaning and covering his face while doing his homework assignment. You go over to his desk and ask him if he needs help. Now, this is important. As Sigmund Freud said 100 years ago, malfunctions, responses that we take to be malfunctions, like blurting out, risk-taking, not following through, forgetting, breakage, misplacing and losing objects, can have psychological meaning. It's not just the body malfunctioning. Now, it's very important because the person doing the behavior doesn't have to know the reinforcement, the meaning. That's the whole problem of unconscious. So just because people say, I'm driven to distraction or I can't stop myself, doesn't mean that that's the only interpretation or how to understand what's happening. The person doing the behavior doesn't have to understand how it is it comes to be that they did that behavior or that they're having trouble in that situation. For example, a child more often yells, especially when near an open window. Now, in traditional view, you'd say he's unable to access executive function, remember the privacy rule, and self-regulate the negative emotion. Or his parents are more often roused when he reacts in that fashion. In sum, ADHD is not caused by the environment or biology. Biology increases the likelihood of ADHD, and the environment reinforces ADHD. High frequencies indicate frequent reinforcement, and if you approached ADHD within the realm of psychology, you'd make a detailed history of conditioning for each individual. Rather than say you assert you're biologically impaired, you'd start to understand living in the world patterns for this person over time. Remember, learning doesn't mean environmentally caused. Biology always factors in every behavior. You need a biology to do a behavior. And your biology changes as you behave in the world. Just like as you exercise, your body changes. Now, what are the conditions under which ADHD behaviors are more likely to be reinforced? Disapproval, failure, insecurity, difficulty comprehending, loss of authority, unwelcome transitions. It's different to say, come on, come over here, we're going to the antique store, or come on, we're going to Toys R Us. Which is going to have a transition problem or an ADHD response? You see how it has to be the learning history of the child with the situation. Evaluation, extended speaking. How many ADHD people are going to be in this talk? Being denied. So comfortable situations that infrequently trigger ADHD are situations that the child initiates and enjoys. Ask the child if he's into professional wrestling. You'll get a whole slew of facts and figures and data and organized responses. When the activity is associated with competence, success, discretionary authority, social acceptance, when you feel accepted in the group, you're not going to do a lot of the ADHD behaviors versus you feel anxious about acceptability. So this is a useful tip as to how to understand this is, if it's someone else's agenda that's determining what's going on socially, ADHD is more probable. If it's the child's agenda, ADHD becomes improbable. If it's someone else's agenda, ADHD is probable. So you see who has to accommodate to who is the issue. If I have to accommodate to the child's controlling the agenda, you're not going to get ADHD. The child has to accommodate to me, what I want, you're more likely to get all the ADHD responses. Now, ADHD for me breaks down to failures to accommodate to social limits and expectations. They're kinds of immature infringements and avoidances. So the child is intrusive when you want them to modulate to others, and they're avoidant when you want them to participate. Now we're going to go to a different part of the talk. We're going to talk about traditional treatments and what to do about all this. Traditional treatments based on two main interventions, medication and stringent discipline. The key benefits is if you give medication and you try to control the child, you can get rapid results, and it's easy for people to try to control it. If you have social power, you can control somebody else. And if you give medication, you can get an instant change for 80% of the kids. Drugs are the most powerful tool. They say you have this developmental problem, you're going to have a lifetime of medication, and since they've been around a long time, the people doling out these drugs say they're the safest, most studied of all psychiatric medications, which is probably true because they've been around. They were using it to stimulate the military, to keep the military going. World War II. Now let's talk about some problems with medicinal treatment because it's not a free ride. Most of the data is short-term. So when they run these drug studies, they're usually 4 months in length. There's now data to show that you get diminishing effects over time. There was a big study called the MTA study. They studied 5 or 7 huge clinics, and they had hundreds of kids involved. And at first, it looked like the medicated group were going much better than the kids who had other kinds of treatments. But then when they looked at the study 2-3 years out, the medicated group ended up being no different than untreated kids. So they had no longer maintained superiority. Now, Johns Hopkins just came out with a study looking at medicated kids 6 years later, and they found that the medicated kids were no different than untreated kids in terms of ADHD symptoms. So while you might get lulled to sleep and think the problem's solved, it's not going to be, at least for most people. And if you rely on the medications and don't go to therapy or do something else, because really everybody relaxes when they go on the meds because it seems to work so well, they could work for your kid and they could be fine, but the data is now showing that it could be a problem to just rely solely on the meds. Now you see this with all kinds of drugs. When you first start drinking alcohol, you get a different effect than if you keep drinking alcohol throughout your lifetime. Or if taking any drug, you start to have a different effect for you. Your body starts to deal with the chemicals to have to compensate for the chemicals that the drug is giving you. So you're doing all these things to adjust to the drug. And then if you take the drug away, your body's now adjusted to having the drug, so now you have a problem getting off the drug. So it's not a free lunch. You get unwanted biological changes, and if you start to get used to the drug and need higher dosages or you need multiple drugs, then you get more likelihood of side effects. You have difficulty stopping because you get acclimated, and you don't learn to live in the world without the drug. Now psychologically you get a view that, gee, I wonder if I could have done that without the medication. So you start to learn, you don't get reinforced that you can do things without being stimulated from the. Now, young males were taking Viagra to enhance sexual experiences, but then they show studies that when they do that, they start to get anxiety about sexual performance without Viagra. So it's the same thing with everything. And if you do steroids in sports, you get increased performance too, but then what happens to you? Now, it's interesting increasing usage because when you go to an ADHD clinic for adults, most of them are on multiple meds. So once you start off on this thing, you end up, oh, then now you got this disorder in addition to that disorder. You're on multiple meds. So the other very serious problem is that families, the urgency, when you take a drug, it takes away the urgency of the problem, and urgency what gets people to work hard and change. And that's one of the, people don't really necessarily do the drug and do therapy. They do the drug and then they kind of stop. And that's what ends up happening. So people are relying solely on the medications. And if problems remain years later, it's harder to change a child who's much older. Now, Consumer Reports said that the drugs help 60 to 80% of the kids. However, there's no good evidence showing these benefits last longer than 2 years. That's Consumer Reports. Now, the thing is that the people who do these meds are still telling, I still get clients that say, if you don't put your kid on meds, you're doing your kid a terrible disservice. But aren't they reading this data? I don't understand it. This data is available to everybody. Why do they still think that what they're doing is still the only way to do it? There's enough data coming out now that says question it. Now, what about the psychosocial interventions that you would get if you went to pediatric places and hospital settings and all the medical sites that are putting out large numbers of people with these diagnoses and treatment? They tell the parent to remind the child, put out signs, set timers, rewards, punishments, control the child can't control himself. Bring the future to the present. The child can't think of the future on their own. Remember the inhibitory problem? They're acting for immediate gratification because they can't stop and think about what they're doing. So you have to provide them with this external monitoring, external management. So now what you're essentially doing is you're training your child in a way that's similar to what they do with people who are institutionalized. That's called contingency management, which they do in jails and any other residential settings. Essentially taking your family and turning it into run like an institution. And you're going to get all the behaviors and side effects and limitations of that kind of socialization pattern. So there can be considerable side effects when others employ these tactics. But the presumption that your child can't control themselves leaves you the only option to control the child. That's the direction you're going to go if you presume this is a medical disability. One of the important side effects is the behaviors are learned when the manager is involved, but what happens when the manager is not involved, watching over? You get an underground society. Now, it's interesting, too. They do a study that show if you take a preschooler and you randomly assign them to 3 groups, the group that you say to them, if you draw pictures, we're going to give you a reward. When you don't give them a reward after you expose them to that condition for an amount of time, they will draw pictures less often than they did prior to the experiment. So you lower the chance that your child will do things without the reward once you add the reward. It's almost like the medication. Once you start the medication, what do you do? Now you take away the medication, now the person's worse shape than they were without the medication. So traditional methods do not nurture self-discipline. They take the presumption of incompetence and you to control the child. Now here are the usual set of side effects that go with contingency management: evasion, maneuvering, procrastination. Well, wait till the last moment till they're about to hit 1, 2. Okay, just do it before 3, right? That's what you're training the kid. 3 and I'll get you, right? So you got to do it before 3. Submission, anxiety, minimal conformity. Maybe the child learns to copy the same thing. You control me, I'll control you. Cat and mouse game. Selfishness, because the parent's saying, do what I say. So how is the child learning to coordinate 2 perspectives? They're learning to do what the other person says. The other person is in control. So I had the what I think is a bright idea is if ADHD is unlikely when the child's interested, why not design a treatment that increases the child's interest in doing what others value? That's when ADHD is less likely. So the proposed alternative intervention, rather than control the child, is based on where individuals would learn valued responses with less supervision and coercion, and where you nurture the child's self-managing skills, you don't assume they're impossible to develop. Now here's the general principle that parents would be doing in this approach. You help the child understand what's reinforcing current behaviors without criticism or blame. So, why would you want to wear a watch? Right? Why would you want to wear a watch? You'd have to come home for dinner, right? You know what time it is. So the kid kind of starts to learn about, and kids smile because they know that a lot of their behaviors are avoidance behaviors. It's this other. You help the child. So the idea is, if you're not coercing the child, what do? So this is what you do instead. All right. You identify positive alternative and actions and outcomes. You work with the child to identify what else could you do. If that kid hit you or took your pencil, instead of kicking them, what else might you want to do if you're in school? And you help the child figure out what to do. And if the child generates what to do, they're more likely to do it than if you say, next time tell the teacher. If the child initiates it, remember, if the child initiates it, you have less ADHD. Explore complications, harms, and obstacles that are likely to be encountered when particular solutions are enacted. So what do you think would happen if you don't pass your homework in tomorrow? What's going to happen to you? Are you prepared to have that happen to you? How do you think you feel if you take that option? Or is there a reason why you want to do it that way? Or how does that work out better for you? And you get the child, you notice if the child starts thinking, what part of their brain is going to develop? The very part that's not developing with ADHD kids. Increase the child's awareness of past successes, so then you help them be less intimidated. So you help pair the association with success rather than failure. Address and resolve problems that disrupt your relationship with the child. What you're doing is you have a relationship with your child. You don't have a control of your child. You have a relationship with your child. If you think you can control your child, lots of luck. That's why ADHD was invented, because that's the counter way. And they try to when developing self-reliance and cooperation, you treat your child as competent to succeed. You seek her opinion. You value her input. You facilitate buy-in. You strive for affirmation. You look to see if the child, is it okay with you if you do this now? And you see if the child says yes. It makes all the difference in the world if you get consent. Consent makes a difference in psychology. Think of doing the same behavior without consent or with consent. You don't want to, yes, dear, yes, dear, yes, dear, because then we're going to get what? Avoidance, tune out, right? Doesn't listen. Doesn't listen to your directives. You promote the child's problem-solving initiatives and independence. The child specifies when, where, and how a solution will be autonomously enacted. I'll get into that. We'll have an example of that later. Parents ask, would you like to complete this on your own so you'll be able to do it when I'm not around? Now that's different than, I'm not doing this for you anymore. You have to do it yourself, right? The adult helps the child identify solutions that are positive to the child. How do you want to handle that problem? What could you do to take better care of yourself when you're in that situation? Will that be an improvement for you? What changes will help us? What do we do if the problem keeps happening? Now, who's learning to self-manage? Who's learning management skills? The child. Who's going to learn management skills if you tell the child what to do? Get your coat, brush your teeth, right? Okay. Parents develop the child's concern for others. They model behaviors they want the child to enact. When the advertising comes on, would you please pick up the toys? Instead of giving a command that negates the child's interest. Parents are teaching mutual caring and respect. They're learning to consider multiple perspectives because you're working with a child. They learn to understand the difficulties that others face in particular situations, to develop compassion. They focus on what's in it for both of us when resolving problems. It's not just about me as the parent. It's about we both living together. We have a relationship. And then the hope is that they learn to do that with their spouses and employees. You nurture a positive relationship. You're teaching sharing, compromise, turn-taking, routines. Now, this doesn't mean permissiveness because the parent has to learn to stop facilitating when the child's intrusive or exploiting others. You don't accommodate to negative behaviors. You might have to lock up the child's bike if you decide that it's too dangerous for the child. It doesn't mean you don't set limits, but coercion is a last resort. It's not a first resort. Now, these are all evidence-based interventions. It's not as if I'm coming off the moon with this. All these methods have been shown to facilitate goal achievement for people. They stop avoidance behaviors, and they nurture positive relationships, resiliency, and empathy. So here's 10 guiding principles for this approach. You use coercion as a last resort. When behaviors are learned with reduced coercion, interest is increased. The child's more likely to cooperate and achieve even when you're not there. You have to stay calm because a lot of people think that ADHD is a failure to emotionally regulate. So if you're yelling or upset, you're not helping the child learn calm responding. So the first thing is to role model that. I know you're angry, but I can hear you better if we talk quietly. Take steps to address and resolve problems. So don't just let everything go by. You have to solve a problem because it has to do with how you're living together. I haven't been getting enough time on the computer. Let's figure out a way to take turns. Be patient. Remember, it takes all of us many trials to change behaviors. So it takes the child time to learn. It may not be as quick as medication, but you may find you get results relatively quickly too because your relationship's going to change with the child. Suspend judgment. Now here's an example of judgmental responding. This report card looks terrible, as if the disapproval will get the change. Now what if you said to the child, how do you feel about this report card? What do you like about it? Is there anything you want to change? This won't be accomplished in a day. The child's going to go, I don't know, right? So in the book I talk about it's because the kids close down from feeling comfortable with that they're going to have an idea or that it's going to be received or that what they can say is useful or helpful or smart or not smart. So you're going to get an I don't know until it's safe to have this kind of interaction. But that's part of the problem. It's easier if you start with little ones. Like if you take a kid when they first start walking and they start wanting, then they learn that if they touch things they're not supposed to touch, they can control everybody in the room. But yeah, if the parent gets up and stops the kid and puts the kid back down and then takes toys out and shows the kid what to do, the kid learns, well, if I go over to that, I can get my parent to stop talking and then give me all these toys, right? It's too much. So it's very subtle things can keep reinforcing the limit testing. So what if the parent non-vocally just went over to the kid and just go like this, away from the thing, let the kids settle themselves down, find a toy. A lot of these kids that look like they're so hyper and they're one object to another, if you do this repetitiously, eventually the kid settles down and starts playing with something. They have to learn to play with something. They can't always get attention. Can't always be the center of attention. So you got to train your kid to be self-reliant. It's very important. And you have to start early, because then by the time they're 6 or 7, they've already learned how many exchanges of getting attention, controlling people with all these things. And so you say it positively. You can't have snacks before dinner. Let's keep our appetites so we can eat together real soon. And don't pay attention to the advertising of Wieners. Negative. If you don't let me finish my shopping, you won't get your allowance. You notice how you can frame every sentence negatively? Or instead of having to come back to finish our shopping, we can finish now and have time to play later. What's the advantage of cooperating, not what's the threat? If you train your child with threats, you're going to train anxiety. You want to get your child to be afraid, or you want your child to see what's the benefit to doing something in a different way. Negative. You're wasting time again. Maybe it will work out better for you if you start that project now rather than later. Don't bother me right now. I can play in a little while. If you can't keep up, you'll have to get a tutor. We're willing to set aside money for you to get a tutor. Doing it for you. Customer service. Treat your child as competent to succeed. Now, once you have a presumption of incompetence, which we do all the time, you have to read the directions. I'm talking to the kid as if they don't know anything. How can you find out what to do? Treat the child as competent to succeed. Do you remember that we have an agreement? Do we still have an agreement? Presuming the child, do you remember? Or do we still? I'm going to set a timer. Would a timer help? Who becomes the participant in the decision making? I want you to study for at least a half an hour. How much preparation do you want before you take the test? So they do studies that show ADHD kids don't estimate time well. Well, they don't practice doing this stuff. The parent's doing all the managing. If somebody else does all the bill paying, who pays attention to the bill paying? Who pays attention to what's being spent? The person paying the bills. Let me help you. I'm available if you'd like to talk things over. I'm going to lock this up so you won't touch it. Can I count on you to leave this alone? Will you wait till we can do this together? Affirmation. You're not allowed to play with these toys because you didn't pick them up yesterday. After you finish playing, are you okay with picking up when it's time to stop? Then the kid, and then you see what happens. And you say, gee, you said to me you would do it. Did you change your mind? And the kid might test you a while to see what you're going to do. It takes a while to get into a different relationship with a child. Now you want to establish buy-in. When your child's comfortable with what is happening, he's more likely to cooperate and do his part. 9 is you assert yourself, because a lot of times the ADHD kid is the one in control of the family. I'm happy to keep buying these snacks if we can find a way to share them. And you want to foster independence. For example, instead of ordering your child's meal at a restaurant, encourage him to order his own meal. So let him learn to do it. Now here's an example of shifting an ADHD child away from reliance on parental cue, which is, remember to take this, take that. Oh, don't forget to take your book with you. Get your backpack. All right? So instead of doing that, you can do this. Maria, looks like you've been forgetting. Maria is the mother and Sonia is the child. Looks like you've been forgetting to take your backpack to school. Has that been a problem for you? Yes, I need it for my lunch and homework. Would you like to figure out a way to remember it? Yes. Okay, let's work out the details. Is there something that you always take with you in the morning? My bracelet. Well, how do you remember to take your bracelet? I always keep it on my bureau. I see it when I'm getting dressed. Would it help you if you could see? Would it help you if you could with your backpack in the morning, just like your bracelet? Yes. I could put it next to my bureau. Would that help you remember to take it with you? Well, I'd see it, but I put my bracelet on as soon as I get dressed, and I don't leave until later. I might still forget it if it's in my room. So where do you want to put it so you'll always see it and remember it before you leave? If I leave it next to the door, I'll always see it. What will help you remember to put it next to the door each night? When I finish my homework in the evening, I'll put it near the door. What might help you remember to do that? When I finish my homework, I always put it in my backpack, and I can put my backpack next to the door when I finish my homework. You get the child to make the attributions of what they're going to do. It's like a rehearsal for a play. If the child's doing this, they'll remember. That's why you rehearse for plays. How many parents do this? Shift the locus to the... This is called shifting the locus of control with the child, so the child starts to see that they're managing things. I know when my clients are going to forget their sunglasses because they put the sunglasses out of sight, right? And I get a lot of sunglasses. So this is the end. In conclusion, the debate isn't about data. I showed you the data. I showed you how to reinterpret the data. It's not about data. It's about how to interpret the data. The debate isn't about data. It's about ADHD empiricism can be understood within a learning paradigm, which doesn't have anything to do with discounting biology. Now, it's not in vogue to understand ADHD as I have been presenting, but I'd like to think that this is a very reasonable way to interpret data. It's more consistent with the other view because I don't have to deal with false positives and negatives. I have a better prediction rate when the behaviors occur and don't occur. There's no blanket statement. Now, here's some very important problems that my view avoids. If ADHD doesn't occur, traditionalists, the biological perspective, will say, well, the situation must not have taxed the inhibitory system, so you didn't get the ADHD response, or the person must have been interested, so ADHD doesn't happen when they're interested. But now you can always argue that way and explain it away, but they never rank order situations for how taxing of an inhibitory system the situations would be, nor they just say, well, you must have been interested. So why'd they read the Stephen King book if I can't concentrate, right? Well, you're interested. So anytime I show competence, because I'm interested. So it's a post hoc way to just explain it away. You can never have a data that refutes the approach. So there's no corroborating data, it's simply post hoc assertions. Now this is what I like to think is the most important issue. The inhibitory model is flawed. If you have to inhibit to know, how do you know when to inhibit? You pause when you're aware of a problem. It's not that the pause enables the awareness. So I stop when I'm near the street because the street triggers the stop. It's not that I stop and then trigger the street. The street triggers me to stop. Dogs will stop at the street corner. If you're about to say something, you catch yourself is because your language, your voice can go slower than your thoughts. Your thoughts faster, so you already guess it's going to be a problem, so you stop. So the person with ADHD may not stop provoking a teacher, but if somebody walks into the room and they stop immediately, so they not get caught. So because that's what evokes the stopping response for them, then depending on their situation. And then the last thing is, by their own admission, there's no reliable way to distinguish lack of compliance from ADHD. So even if you say oppositionalism is saying no before you start to respond, why can't I say no while I'm doing it? Why is that always ADHD just because I quit in the middle? I could stop doing it because I feel like I'm failing, or it's not enjoyable. So how do you decide what's ADHD and what's psychology? What's the biology? What's the psychology? You see, I avoid all these problems, and they don't have a way to discriminate those two things. So a final thought. Is ADHD incurable, as traditionalists claim, or are the poor outcomes the consequence of treatments that rarely produce impressive long-term results? That's it.